Hello and welcome to a very special episode of Community Connections. I am your host, Anna Orr, and this is airing on OROMIA11. Today we are talking medical assistance and Minnesota Care renewal. This is very important information, and if you have somebody in your life that is either looking to enroll in one of those programs or needs to re-enroll, please grab them and put them right in front of the TV or in front of the computer screen because this is going to be some very pertinent information. Stay tuned. Jetta, I'm so excited to have you joining me on another episode of Community Connections. We were here about June of this year, talking all things insurance, correct?
Oh, yes.
Medicare, Minnesota Care,
Big
and
fun.
trying to make sure that viewers were prepared for exactly where we are right now.
Exactly.
Can you introduce yourself and that of your organization to viewers that may be unfamiliar?
Good. Well, thanks for having me, Anna. My name is Jetta. I am with Trellis, which is a nonprofit organization. We are the area agency on aging for the Twin Cities metro area. And so all things related to aging, we have our hands in, and we affiliate with the state of Minnesota, the Senior Linkage Line. And so we try to provide resources and referrals. We provide services, innovations, and connections to help people thrive as they grow old.
Now we are really in the middle of open enrollment, correct?
Well, we're kind of in the middle place.
Okay.
Open enrollment for Medicare was October 15th to December 7th, and so that was where we made decisions about Medicare. We have a pause for a couple weeks to catch our breath, and then folks in Medicare Advantage plans, they start January 1st to March 31st.
Okay.
So if there was a plan that you chose during the last quarter of 2023 and you don't like it, if you have a Medicare Advantage plan, then we can go into an open enrollment period. But the bigger issue for I think a lot of Minnesotans that are in anxiety stage is that they have health insurance through medical assistance or they have health insurance through Minnesota Care, and as a result of what's happened with the public health emergency, there's some anxiety about how to renew their coverage.
Now let's talk a little bit more in depth about that for people that may not be familiar about, I guess, being able to delineate between the two.
Sure.
What is Minnesota Care and then what would be considered medical assistance?
Right. So medical assistance, that is Minnesota's Medicaid program for low-income Minnesotans. And so federal dollars stream into that. For other individuals who might be on Minnesota Care, that's also for Minnesotans who are low income, but they don't have access to affordable health care coverage.
Okay. That makes a lot of sense now because I'm sure people are hearing, okay, well, we're accepting Minnesota Care or we have Medicare, and then you're going, well, where do I fall?
That's true.
Especially if you've had someone, say a navigator or a carer, provide you with some support in filling out documentation. You may not know where you actually fall.
And when we go into the community all the time, most, we work with seniors and older adults. Most individuals don't have any idea if it's a UCare, if it's a Minnesota Care, if it's a Medicaid, if it's Medicare. They just know that they want their health insurance, and so that's where we start.
Can you talk to me about what's taking place now, seeing as COVID-19 and all the emergency assistance is ending, as you spoke about a little bit earlier?
Right. Just a year ago, in December of 2023, President Biden called off the public health emergency that was wrapped around the pandemic and COVID. And so COVID hasn't gone away, as we understand as a society, but as of May of this year, the public health emergency ended. And what happened in, let's say, 2018 and 2019, people who were on Minnesota Care or people who were on medical assistance, one of these two programs, every year they had to go through a renewal process. Well, the pandemic and the public health emergency stalled that. And it's a good thing because when you're in crisis and you're struggling to just get by in the world, the government at the federal level asked the state of Minnesota, we're going to pause all of the renewals, the bureaucracy, the administrative, the providing proof. We couldn't go into government buildings, we couldn't do normal things. So during the pandemic, there was about 360,000 people that gained access to these two programs, a medical assistance or Minnesota Care. And so they never, in these 3 years, had to go through a renewal. They just realized the card came in the mail, we got to use it at our clinic. Card came in the mail the next year, we get to use it. So now that President Biden and Congress called the public health emergency off, we have to go back to where we were prior to 2020. And that just means that every year we have to do a renewal. Whether you're on medical assistance, you do a renewal the month that you became eligible for the program, or if you were in Minnesota Care, the Minnesota-based program, we do that at quarter 3 or 4. That's where we're at right now. For folks who are in Minnesota Care, they're going through that renewal process. And I think that's when you talked earlier, if you have some friends who are anxious about it, they've never done this before, is because they've likely probably gained access during this really awkward, weird time of a pandemic, and they just don't know what to do now.
It's the truth. They both were saying that they were concerned about the renewal process, but they also didn't know where to begin with any of this stuff.
Yeah.
And so we kind of talked about some of the materials that they were looking at, and they pulled out, both of them separately, pulled out these giant packets. Mm-hmm. So can you talk a little bit about what is inside of these packets and kind of help people kind of understand what to be on the lookout for if it's coming to their home or if they're receiving calls or text messages?
Right. Well, a lot of people get really anxious when they get mail from the government, the county, the state, wherever. And I have a brother who actually gets the mail and he puts it in a pile and he doesn't open it. So I always tell him, that's a strategy.
Right.
It's just a bad strategy. So for our viewers, one of the best things to do is open that mail. And it looks like that, right? It's an envelope from the county, and it basically has a blue dot on it. And their marketing is, when it's time to renew, look to the envelope in blue. And so catchy. But open the envelope, right? The packet that they're getting, the first one basically says is next month you're going to be in renewal. You're going to need to renew your coverage. Mm-hmm. Then the packet comes that has all the details, and any of us who've gone through an open enrollment period for our health insurance, whether it's a private company or whether it's through a government program, there's just a lot of paperwork inside of it. And so, if you can weed through it and start to read it. The most important thing is to make sure that the county has your address. What happened during the pandemic, we've got 360,000 new people that are on these programs. They've never been for a renewal. They're taking these envelopes and they're circular filing them, right? Mm-hmm. So not the best place to start. But the county or the health insurance program needs to know the address of this person. They need to know the phone number of this person. They need to know the particulars about their family, whether it's individual coverage or family, just so that the county can communicate, so they can get the big packet that you're talking about. And in it, it's got step by step. But as we know, some people are very verbal, and some people are they read, and some people listen to things. And so my suggestion is find a friend. You remember the old phone a friend trick? There are people in your life that are either older and get confused about it, they're younger and they don't understand. It doesn't matter who you are and how old you are or just your ability. Find someone. It could be at the county that can help you. It can be at the senior linkage line that we can provide assistance. It could be a neighbor like you. They're calling a friend, but phone a friend and don't let the deadlines go by, because what's going to happen is people are going to lose eligibility. The county's going to send a couple letters out, and then if individuals don't renew the coverage, the county's like, they moved. And then at the termination, for instance, if your renewal date is December for medical assistance, you would have been, notified a couple months ago, and then November, and then December, and to say the last day of this month is when you have to renew your coverage. Mm-hmm. If you get to the last day of the month and you haven't renewed, you're done, right?
Okay.
Now, what we found as of May, we started this in May because that's when we called the public health emergency. So June and July and August were our test month as a state. What we found is over 100,000 people were not renewing. We thought that they were likely eligible for the program, but they weren't. And the federal government asked the state of Minnesota, will you please give them some grace? And will you please allow them to renew? And the state of Minnesota decided to do that. And so they've been giving notifications to agencies like ours and county agencies to keep educating people about the health emergency and the ability to renew the coverage. There were other states south of us that 50% of the people who were eligible for were kicked off the program. We are a progressive state. We want to serve. We want to provide a safety net for people. We're a kind, gentler state. And other states, they don't have that track record. So I'm just glad that I live here in the state of Minnesota.
That's the truth. Now, we talked about finding a friend or maybe calling the county or calling Trellis to receive some support. But for people that are not English speakers,
Yeah.
are there interpreters? Is there language assistance for
Absolutely.
those? Are there support for people that are hearing impaired?
Yeah, all of that is true. It might take a little longer, but we know that the assistance is there. When they call the county, there's always a language line that they can dial into. And if they call the senior linkage line, we can translate into 100 languages. For anyone who is listening to this in English and you have people in your family that speak another language, the message is, I speak English, I speak Spanish, I speak Oromo, whatever it is, and just say, I need help, you know. And if I always tell my staff when we're educating the public, give it about 90 seconds. Give it about a little bit of time, because they have to dial into the system. They have to pull the person on the line. Now, when we talk about phoning a friend, I have family members that are they have two languages, right? That are fluent in Spanish and English. If I knew that my family member was struggling, I would make sure that I was there to be able to translate, if I could do that. And so a lot of our younger generation might be able to translate for a family member who doesn't speak English, but the county should be able to do it. Health insurance companies should be able to do it. Trellis through the senior linkage line is able to do it. It just takes a little bit longer to do that.
So just a little bit of patience, ladies and gentlemen.
And this time of year, we need it, don't we?
It's the truth. It's the truth. But this is so important. And so I think having just a little bit more patience to get the assistance that we need to have an overall better quality of life as a Minnesotan, I think is going to be really important and really beneficial.
Absolutely.
To people all over. I just want to talk a little bit about why we're kind of having this conversation. Not only is it time to renew, but also COVID-19 numbers are on the rise again.
Yeah.
The flu has mutated and people are catching that. Colds are getting more and more intense for people, and people are needing to go to the doctor.
RSV is on the upshot for both
Urgent
infants
care.
and our oldest generations. It's like this crazy tsunami thing that we're in. So yeah, you're absolutely right.
There's so many people, though, that are needing medical intervention of some sort, whether it's checking with your primary or going to an emergency room. And I don't know about anybody else, but it's daunting when you know that you don't have proper coverage. And that may stop you from getting the support or the assistance that you need.
You know, and when people typically have the insurance card, they're more likely to go to a medical visit and preventative, and vaccination clinics. When they run out, they're going to end up in an emergency room. And that adds, think about the time of season we're in, just at the end of the year and flipping over. Some people have high holidays, others it's just the end of the year stress. And think about someone losing their health insurance. Right. I actually have someone in my inner circle on my staff that lost coverage for the month of December. And I said this morning, what are you doing? And she goes, we're not leaving the house. We're masking the baby. We're not touching anywhere. We're washing. She's got 2 more weeks until January 1st hits and she has coverage again. And it was an error, and she doesn't have coverage. And so for the month of December, she's in that stage of lost the coverage, works full time, really hard worker, and it was an administrative error. But it really happens to people. And so if something catastrophic happens, if we get hit by the car, if something happens and we have a stroke, right, where are we? And so when this mail comes in, in your post box, it's important to be able to look at it, because no one wants to be in a place of having some catastrophic thing, or even the flu that puts us into a place of getting, maybe pneumonia, and then we have to have a further stage because we don't have that coverage.
Has there been any changes to enrollment or eligibility requirements as a result of COVID-19?
Well, there hasn't been any changes. It's just, again, we paused it during that 3 years. I think we got out of habit of being able to do it. And during the situation, as you remember, when we were in the pandemic, teachers got overwhelmed and they started to retire. Social workers that in our field started to retire. And so we lost a lot of the brain drain. Now, we have brilliant social workers now and great county workers. I don't want to knock them at all. But sometimes if you haven't been through it, it takes you a little bit of time, right? And I liken it to riding the bike, right? when you start riding a bike, you fall down a little bit, you bruise your knees, it's clunky, right?
True.
And we'll get used to it. The system will get better. We estimate at Trellis that it'll probably be next November, a full year and a half by the time that people are back in the swing of this process and they can get it good. But you know, these 360,000 people have never done this before, so they're riding the bike for the first time.
Right.
Or we've got new social workers in the system, they're riding the bike. You know, it's not pretty, but nothing has changed per se.
So as we're navigating this, can you provide the information, the contact information for Trellis and the senior linkage line for anybody that needs to call in or that probably wants to make sure they've turned in everything that they need to so that there isn't room for, at least on our end or on their end, for an error?
Yeah, there you go. So if individuals are working for someone who's a little bit older, and every culture defines what older is. In some Hmong communities, 55 is older. In some white communities, it's 70. You know, so anyone gets to define it. We don't decide who gets to call and who doesn't. But the senior linkage line is 1-800-333-2433. Now this is an 8 to 4:30. It's a state agency, a state program, and individuals can call Monday through Friday. So they don't answer those phones in the evening, and they don't answer the phones on the weekend.
That's understandable.
Yeah.
I'm sure they're accepting a very large volume of calls.
My goodness! And we just
so
got
they probably
done,
need a break.
We just got done with Medicare open enrollment, so people are, you know, they're taking a little bit of a break. So if the individual's older, they can call the senior linkage line, and we can help them with that. If they happen to be younger, and they can certainly do a couple things. They can contact their insurance company themselves. Each one of us gets that cool card in the mail. Turn on the back, customer service, and you can call in and say, hey, my name is Jetta. This is my address. Does your address match my address? Right? Here's my phone number. This is my details. And then you can have some peace of mind of whether or not, you know, you're actually going to get it. Because renewal for medical assistance is different than Minnesota Care. Minnesota Care is October, November, and December. Right now, people who are lower income and they don't qualify for medical assistance, but they qualify for the state program.
Okay.
They're going to have this quarter of October, November, December. Eligibility goes to the end of December for renewals. January 1st is when the coverage starts. So you can contact your company or you can contact your county, right, to find out, to make sure you're getting it. Some of the folks I've been talking to, they actually get text messages. Our counties are getting very sophisticated.
I was going to say, I
right?
did receive a text message, and they were saying that they were looking for someone specific, and then, you know, this is the information, but provided some links.
Right.
And I was very impressed. I said,
like,
this is very tech savvy. I was like, okay. Because think about it. How many people are walking around with a phone on them versus I have a stable address?
Yeah.
A lot of people have had to move pillar to post because of whatever.
And that's why the counties are having so much problem, is because of COVID, people had to downsize, they lost their income, they lost their job, they moved in with their daughter, or they moved in with a relative. And so that's why a lot of this bulk of the problem is that phones were cut off because we couldn't afford them, and now we got a new number, so they can't reach them that way. They moved, they can't reach them that way. So if individuals can call the senior linkage line, they certainly can. They can reach out to their health insurance company, they can do that. Or this number here on this slide it's mn.gov, which is the state of Minnesota's, /DHS, and it's just renew my coverage. Just renew my coverage. You can Google it too. And that will get you to a platform to see, you can, for some folks who have their policy ID and their identifiers, they can put it in and go, oh, my month is February.
Okay.
So they'll start to get the mail in December, and then January, and then they renew in February. But if you're not getting mail, that's how you figure out is mn.gov/DHS, which is Department of Human Services, /renew my coverage.
That's wonderful. For those of you watching at home, please make sure that you are going through that pile of mail that is sitting anywhere in your home. There is some very important information there that I think may make your 2023 and your 2024 a lot smoother.
Absolutely.
Jetta, I'm so excited to have you join me today, as always, because you provide such necessary information, but you also keep us abreast about what's going on in the world around us. And I know for many people like myself, if you get overwhelmed by things like that, it makes you kind of want to detach. But these are important notes. Yeah. While I have you here, can you please just take it and just look into this camera here And just appeal to someone at home that's saying, I'm nervous to do all that. I don't like having to fill out a lot of paperwork. I don't like to keep track of deadlines. And I know that I do need to see a primary, or I do need to get a booster shot, or I would like a flu shot. But I'm scared.
That's true. Well, what I would say, Anna, is that you've got this. You don't have to be a rocket science to go through this process. You don't have to have it all together, right? This is the time of the year that some of us decide that it's just okay to be okay, right? It's just okay to be okay. It's okay to ask for some help. It's okay to reach out for assistance. And if you can contact the county, you can contact the senior linkage line, you can contact your medical provider. Maybe you have a neighbor, maybe you have a friend, maybe you have someone in your faith community that has always been there for you. Or on the other side, maybe you have that grandmother that's struggling. Maybe you have your mother, or you know someone at your church or the mosque or the synagogue that you're just kind of worried about. I think last time we talked about being a good human. Be a good human. Phone a friend, ask for some assistance. There is no shame in asking for help. In fact, I tell folks all the time, those of us who ask for help show our strength. So don't get left behind. Don't allow you to be swept into a place of anxiety. Find someone that can help you open that mail, or you can provide assistance, because everyone likes to be helpful. So I would say don't be afraid, just reach out and be able to find it, because no one wants to lose that health coverage, because you deserve it.
Thank you for joining me, Jetta.
Absolutely. My pleasure.
Absolutely. And thank you for the amazing work that you guys are doing with Trellis and the senior linkage line.
That's right. It's a happy time over there. We have been doing so many amazing things with older adults, and I know some people get excited, but I love my job and I love what we do, and there's just so much cool things out there. People love people, and we're just finding resources and referrals for older adults. So if no one has ever figured it out, you can Google trellisconnects.org or the senior linkage line to find more resources. But we're always accepting volunteers. We just started a new program with the city of Minneapolis to do one-on-one assistance with folks who don't have any idea how to navigate the system. And so whether it's energy assistance or medical assistance or transportation or healthcare, we have an entire team of staff and volunteers that can help people find their way.
Are you all also on social media? I know we talked about Google, but are you guys also on social media?
That's right. We're on LinkedIn and Facebook, just Trellis Connects. You can find it. But trellisconnects.org is the website that is a great landing page to try to find out all the cool things that are happening at the agency.
Wonderful. I was hoping so that you guys were on social media, so that if you are having someone younger or someone that's a little more tech savvy in your life helping you navigate some things, they can keep abreast as to what's going on.
Mostly it's caregivers. You got the sandwich generation.
Absolutely.
I've got parents, and then I've got children, and we're in that place where we're helping. So we have a lot of individuals that are very tech savvy, that can help the people in our families lead better. Our hope is to optimize well-being as we age.
That's well said. That's well said.
Thank you.
Unfortunately, that is all the time that we have for this episode of Community Connections. As always, I am your host, Anna Orr. And a very special note, while we talk not only about self-care, we talk about health and insurance. Please make sure that you are washing your hands. If you are not feeling well, that you are staying home, avoiding crowds, and if you do have to go out into the public and are not feeling well, please make sure that you are masking up and trying to stay as far away from people as possible, so that you can ensure that you have a safe and healthy, happy New Year, and so can the people that are around you. I look forward to connecting again with you soon. As always, a very, very special thank you to Jetta and her amazing team at Trellis and the Senior Linkage Line. I look forward to connecting again with you soon.